One of the things that I keep getting asked by my patients and by the community where we practice, which is in Bronx, New York, is whether, the air quality or pollution or some sort of environmental exposures could be contributing to their cancer diagnoses in some particular way. And for a long time, it's just been really hard to answer that question. But what we actually did in this particular study is we looked at all diagnoses of multiple myeloma in the Bronx, of which approximately there were 1,500 patients, and we geocoded these patients and we did an overlay with various environmental pollutants. And the one that we thought was of great interest to us was really particulate matter 2.5. So what is particulate matter 2.5? It's any small, maybe carbon particle that's about 2.5 microns. And what we actually found is that patients with a multiple myeloma diagnoses over the past, over more than 8 or 9 years were exposed to a PM 2.5 level that was well above the EPA standard for the United States. And for every extra year that they were exposed to this pollutant, they had like a 7% increase in their mortality. And so this is something that has in our studies, statistically a trend towards significance. But I would say, like, if you look at the larger context of things, definitely the exposure to air quality does make a difference in the person's, overall survival from the cancer. There will obviously be several other factors like treatment and just the biological factors associated with the cancer that contribute to the survival. But air quality is being increasingly scrutinized, and I think our study is a successful way of showing how you can kind of intercalate this information with everything else that's out there with regard to cancer prognosis and survival.